Hi everyone. Good afternoon. My name is Denise Francis, student at Indiana State University Bachelor's Program, and today we will be talking about tobacco and smoking and its effects on the body. Our learning objectives today will be how to identify ways in which tobacco is used, what is tobacco, the effects tobacco has on the body, alternatives are prevention for tobacco use, treatment for tobacco users, and the statistics of tobacco users. In the description, there will be a pre and post test. Please do it, and there will also be an handout. Also, okay, what is tobacco? Tobacco is a plant grown for its leaves, which are dried and fermented before being put into products for use or tobacco products for use. It contains nicotine, the main ingredient that can lead to addiction. Tobacco is the most common name several plants in the genus family of Nicotiana and the family Solanaceae. How is tobacco used? We use tobacco in various ways. We use it pipes, smokeless tobacco. We have cigars. We smoke it in cigarettes, chewing tobacco, and also sniffing tobacco. Next, we'll be talking about the effects it has on the lungs. Our not only the effects it has on the lungs, but also the effect it has on the body. Okay, so one of the major and the main one is cancer. Smoking causes lung cancer. The major cause of lung cancer today is smoking. Smoking also causes cancer anywhere else on the body as well. It can cause mouth cancer and throat cancer. Okay, smoking also leads to breathing problems and chronic respiratory conditions. The main cause of COPD worsens asthma and increases risk of asthma. Okay, smoking also causes heart disease, stroke, blood circulating problems like blood clots. Is the main cause. Smoking, especially when you're pregnant, is a cause of cardiovascular disease as well. It increases risk of your blood clots, as I said, and chance of needing amputation. Smoking can also cause increased effects in diabetes and type 1 or type 2, which makes you have to use more insulin. You know, it causes infections, it weakens your immune system, it causes dental problems, risk for gum disease, tooth loss, and gum sensitivity. And do you know smoking also causes hearing loss? It decreases blood flow to the inner ear. Next, we'll be talking about alternatives or prevention of tobacco use. What are ways in which we can prevent or stop smoking? We have nicotine replacement therapy. We can avoid triggers that cause you to use tobacco for smoking. We can delay the use. If you feel like you're going to give into tobacco craving, tell yourself that you must first wait 10 minutes or more, and then you can do something to distract yourself for that time period. Another one is chew on it. Chew a gum. Give your mouth something to do to fight a tobacco craving. Candy, mints, anything. Don't have just one. You might be tempted to have just one cigarette to satisfy a tobacco craving. No, because once you have that one may lead to getting another one. Get physical as well. Physical activity can help distract you from tobacco smoke. Go running, take a walk. It reduces your tobacco craving. Next, we'll be talking about treatments of tobacco, or ways in which we can treat tobacco cravings. We have nicotine replacement therapy, as I mentioned before. We have nicotine gum. We have spray or inhaler. We have medications. We have physiological or behavioral treatments, and we also have nicotine patch. I know it's not mentioned here, but yes, we have nicotine patch, which helps with the effects of replacement of tobacco. And next, we'll be talking about statistics of tobacco users. The statistics of tobacco users is that, according to research, 25% of men and 5.4% of women worldwide smoke daily. Oh yeah. Low and mostly low and middle income countries where an estimated 80% of today's smokers live. In 2016, 15.5% of adults reportedly currently smoking cigarettes. Of these, 76% smoke daily and 24% smoke less often than daily. Smoking prevalence is disproportionately higher among adults who have less education, lower incomes, and comorbid psychiatric and other substance use disorders. 8.0% of high school students and 2.2% of middle school students in 2016 reporting cigarette smoking in the past 30 days. Yes, these are some of the statistics we have, and these statistics tells us that smoking is very prevalent. I know some of these information that I mentioned, like I know a lot of hospitals are not using, they're smoke free. We have a lot of places, pharmacies who stop selling cigarettes. We have um drugstores, pharmacies, like I said, stop selling cigarettes. Nursing homes, they don't allow smokers, and these are some of the things they are doing to combat smoking. They have like smoking programs that people can join. And one thing I didn't mention earlier, what are some of the reasons why people smoke? Some people smoke, they say, to relieve stress. Some people say it's better than drugs, but it's still an addiction and it's bad for your health. And it's because look at the picture of the lung. I've seen lung worse. That's just a picture, and I've seen lung worse than that. So I would advise people who smoke, it's not healthy. Even the cigarette seller noted on the carton that you buy that is dangerous for your health. So if they're advising it's dangerous for your health and you still buying it, then that does not make sense. So I advise everybody stop smoking, quit, find ways in which we can stop it. And we go to my conclusion. And my conclusions today is to quit. Again, you will find in the section, you will find the pre and post test. In the description, you'll find the pre and post test. You will find also a brochure that encourages you to stop smoking. And the last page of my report is just a reference page. And thank you for listening. Again, my name is Denise Francis.